Hey everyone, and welcome to our monthly member spotlight series. We're excited to announce this new series where we highlight some of the incredible individuals that make up our society. Each month, we'll feature a different member sharing their unique story, celebrate their achievements, and explore their passions. First and foremost, today I'm Tabarak Qassim. I'm a resident doctor at Cambridge University Hospitals in the UK. And today we have with us Dr. Linda Carlson. Could you please introduce yourself?
Sure. Thanks, Tabarak. I'm happy to be here and part of this series. So my name's Linda Carlson. I don't know how much introduction you want. I'm a clinical health psychologist by training. I'm a professor in the Department of Oncology at the University of Calgary, and I've worked in the area of psychosocial oncology and integrative oncology for, I don't know, 28 years now.
Wow, very nice to meet you, Dr. Carlson. So, to begin with, we'd like to know what is your drive behind getting involved in integrative oncology?
Sure. Well, I mean, that, as I said, goes back many decades. So in my training as a health psychologist, I also started at the same time in the early 90s, a personal practice of meditation and yoga. And I had a classmate who was actually had spent 7 years in Thailand training in meditation. And so he taught me how to do meditation. And during that time, I also met John Kabat-Zinn, who came to McGill University where I was training and did a presentation in the mid 90s on mindfulness. And I was really struck by that. And at that point, thought I need to find a way to work this kind of practice into what I do as a researcher and a clinician. And so, it was several years later that I was able to start conducting research on mindfulness. So that's how I got into the mind body therapies. And then it's expanded over time to various different integrative therapies.
Wow, that's a very inspiring story. I'd like to know about the impact you've had on others. Any story in particular that has impacted you about a patient you've helped using integrative oncology therapies?
Yeah, that's such a hard question. So I've been leading mostly mindfulness-based cancer recovery groups, as well as some individual therapy and other groups for decades now. And so many people going through our program see this profound transformation. And if, it's nice to have specific stories. So I was thinking of the very last group I finished just a month or so ago. And for example, there's one woman who was in her late 30s, had breast cancer, had children, was trying to hold down a job, had to take time off work and get special permission even to take our program. And she would share every week just how much difference it was making in just her ability to interact at work, to not get caught up in all the drama, to respond more mindfully to the stress in her life, to prioritize her own well-being, as something that she had to do every day, to sit down to do the meditation practice, and how she would be less reactive and, less irritable, say with her spouse or her kids. And, so that's something we hear all the time, is how it sort of bleeds out into everyday life and people become just calmer and a little bit less reactive. I mean, another story I was thinking of for that same group, a different kind of population that we also see often is an older gentleman with advanced cancer. So he had been living with metastatic cancer for many years. Which is incurable. And so for people like that, it's around how can these practices help them face the existential concerns, the, inevitability of death and dying. How can they come to a place of acceptance? And so all of those themes and many more we often see even in the same group. And many people share that it's quite profound for them.
Absolutely. Integrative oncology has multiple times proved to me it does have a profound and lasting impact on patients' lives. Now I'd like to ask about the people who have helped shape your journey. Who has influenced your work and how did they influence it?
Well, I already mentioned John Kabat-Zinn, and really my early work was in, adapting mindfulness-based stress reduction for people with cancer. And so I'd have to say that that's probably been the most profound impact on my work. And within psychosocial oncology, some of my mentors have been Barry Baltz, who has been he's retired recently, but for 40 years was division head and very supportive to integrate whole person care within our cancer center and also more broadly.
Wow, it's very important to recognize the people who have inspired us along our journey. Can you talk to us about the psychedelics and anxiety grant you received? In particular, we'd love to know about how emotions have been shown to impact cancer and what patient-focused outcomes we hope this research will drive.
Okay, so that's a lot of questions in
Yeah.
one. I think I'll tell you a bit about the network. So we recently got a big chunk of funding for something called the Canadian Network for Psychedelic Assisted Cancer Therapy. So this is not just a clinical trial, it's an entire network that we're developing across all of Canada for people who work in the area of psychosocial oncology and palliative care, and specifically with people who have advanced cancer. And so, really expanding what we've learned about mind body therapies and integrative therapies into this new realm, relatively new realm of psychedelics, and how combining what our plan is to do is to combine some of the mindfulness training with the psychedelic experience, probably with psilocybin, and see if that can work synergistically or accelerate the benefits or treating some of the difficult symptoms people have at end of life. Like I mentioned, existential anxiety, fear of death and dying, a sense of demoralization, or a loss of a feeling of meaning and purpose and really wanting to go on. And there's some smaller clinical trials out of the States that have shown great promise in this area, that potentially even one or two larger doses of psilocybin, along with the proper supportive preparation and integration therapy, might have really substantial promise for quickly and long term alleviating these symptoms that people really struggle with.
Wow, that is insane. That's fascinating. It's one of a kind. I do appreciate you walking us through the grant and the potential impact. Looking ahead, what excites you the most about the future of integrative oncology, and how do you see it evolving over the next 10 years?
Yeah, well, it's been really exciting to be involved with the clinical practice guidelines at Society for Integrative Oncology, just, really reviewing the evidence. So the way I see it is there's developing the evidence, which I've been doing, conducting many, many clinical trials over the years. So there's improving the evidence base, which still needs to happen in some areas. But then there's taking the existing evidence, turning it into guidelines and tools and methods that we can use then to improve implementation and have these therapies that are now evidence-based more widely adopted through healthcare systems globally. So that's really our task now, is to take what we already know. We know there's certain therapies that can be very beneficial, but few people have access to them. So how can we make these things more accessible? And there's through education of patients and providers, but also through using different modalities. For example, we've adapted our mindfulness-based cancer recovery to an app, a mobile app that people may be able to use on their own. And we're testing that in a clinical trial to see, if these more accessible, low cost, widely available types of interventions using technology, can they also be beneficial, and what are the limits of those kind of approaches to implementing evidence-based therapies? So there's lots to be done in that area. And really our vision at SIO, and my vision as a psychologist and a integrative therapist, is to see these therapies integrated as part of standard care for everybody who goes through cancer.
I agree. It's time to translate theory into practice. Very exciting. I'm very excited for the future, to be honest. So thank you so much for your time today, Dr. Carlson. Thank you for sharing your story and insights. It's been an honor speaking with you. We hope you've enjoyed this month's feature with us in Integrative Oncology. Please do not miss next month's spotlight with another inspiring member. Thank you.